Hello everyone, welcome to my channel. Today we are talking theater nursing. So let's start with the definition of terms. What do you understand by the term theater? Theater nursing. So with theater is a room in an hospital in which surgical operations are performed. You know, in an hospital, the surgery is done. For example, you are in maternity and you expected a woman to deliver spontaneously, but then she has to go for cesarean section. So that is one of the surgical operations that you expect in an hospital. Then theater nursing is the art and science of taking care of patients before, during, and after surgical procedures. That is all about taking care of patients. And then we have what we call preoperative phase. Another term that we could like to define is preoperative phase, which is the phase that starts the moment the patient is diagnosed for surgery until the patient enters the operating room. Look at it like that period whereby you are preparing a mother for cesarean section to the time that the mother is delivered or taken to theater for actual surgery. So that period in between is a preoperative phase. Intraoperative or intraoperation phase is the phase that starts the moment the patient leaves. Starts the moment the patient enters the operating room until the patient leaves the operating table. So that time when the patient is in theater, is in the operating room until they leave the operating table is called intraoperation phase. Then we have another phase we call post-operative phase, which is the phase that starts the moment the patient leaves the operating table until they are discharged home. Nothing much to explain. Perioperative phase is the period encompassing the preoperative, intraoperative, and the postoperative phases of surgery. So perioperative is everything. When you talk about perioperative phase, we are looking at the preoperative phase, intraoperative phase, and postoperative phase all together. Then scrubbing. What do you understand by the term scrubbing? It's a procedure of hand washing with an aseptic solution, and the washing is done according to the laid down protocol. So all the, members of the surgical team have to scrub hands according to some laid down protocol before they participate in surgery. Research showed that when they do so, they minimize the number of microbes and actually contribute to survival rate of patients post-operatively. So this is, we look at the period before all this was discovered, and they realized and they even come up with big names, the people who contributed to this kind of research, that scrubbing really is quite helpful in the period of surgery. So we have post-anesthetic care unit, which we normally call PACU. All of us are aware because we rotated in theater. This is a place or a provision, sometimes referred to as recovery ward. It is also called the recovery ward in the operating theater. That is where patients recover. Understand, in theater they use anesthetic agents, the anesthetic drugs, and patients need time during reversal. They need time for the drugs to wear off from the body system. So they are put in a post-anesthetic care unit. And that is not the only thing that happens. Of course, the others could be on oxygen still, or it's an area for recuperation. They are left to recuperate before the next action is taken. So guys, we've looked at scrapping. That is okay. Let's look at any other term like anesthetics. Anesthetics is a term used to refer to the medication given for the pain and muscle relaxation with or without loss of consciousness. It's a medication that is used to facilitate surgery by preventing pain or curbing pain, and also promoting muscle relaxation. At times, patients can lose consciousness or they may not lose consciousness, depending on the type of medication administered. So there are departments of an operating theater. Of course, we know we have the operating room, we have the scrapping room, and the post-anesthetic room. So guys, before I talk about these rooms, I think it's important for us to look at how theater nursing has transitioned over the years. Of course, even we'll come to the zones in the operating theater. Of course, we know there are zones in the operating theater, rooms in the operating theater. We'll also look at legal aspects of theater, the role of nurses in theater. You know, we have scrap nurses, we have circulating nurse, aesthetic nurse, recovery nurse, sluice nurse. In some theaters, you can find all those. In others, some of the roles are picked up by, you may not have all that stuff, but some of the roles are performed by one or more of the nurses. So, let's look at the name. Let us try to classify equipment used in operating theater. We'll classify, we are not doing that now, but we'll classify later. Before that, let us do the history of asepsis in surgery. And you know, in the first century, the bacteria that we know these days, the viruses and all that, were not known, and in fact were being referred to as minute animals that could make people sick, that could cause a disease. But certain people like Hippocrates, I don't know why this word is used to mean something else, but Hippocrates was a big name then, who is the kind of guy who is believed to be the father of medicine, because he could use wine and boiled water to irrigate wounds, and was able to achieve control of infection. And during the 2nd century, there is another guy called Galen who could boil his instruments before use. So, and another guy called Anthony invented a microscope. And from there, they could be able to see creatures. They could be able to see the bacteria. Yeah, I could be able to see bacteria by use of the microscope. So later, Agostino Bassi suggested that diseases are contagious as a result of contact with live microorganisms. So they later discovered that diseases were a result of certain microorganisms. In the 1850s, we have Louis Pasteur. We studied much about him, who came up with theories of fermentation, and he did show us that we can kill pathogens, we can kill microorganisms by use of heat. And there were others like Joseph Lister, Ignace, Florence Nightingale also gave her contribution by stating that the radical changes in sanitation resulted in a reduction of mortality from contagious diseases. So guys, how should a modern theater look like? What should be the layout? Of course, you know, it should be built in a place which is accessible. That is the first thing. So we expect operating theater to be near maternity. Yeah, depending, in some hospitals, I realize they can have more than one theater, but we are saying it should be in a place that is accessible and where it's easy to respond or save lives, depending on the kind of numbers expected from a department. Like we expect many numbers from a maternity ward. Yeah. So so wherever I was working, not working really, but rotating as a student, we had our maternity ward border very close to theater. Yeah, that is how it should be actually. Now, rooms. The rooms, how they should be. There should be progression from entrance to through zones that are, through zones that increasingly approach sterility until we reach the operating room. So you should have a place where people change clothes. Should have offices. You should have the receiving area. In fact, I used to recall this by use of. The easiest way you can remember this is remember there is a semi-restricted area, the restricted area, non-restricted area. So we can have a receiving area where everybody can actually arrive or deliver patient. And there is always a nurse to hand over to. The casualty department nurse hands over the patient to the theater receiving nurse. So we have a theater receiving nurse. I'm doing this as a summary. These are things I think we know. Operating room, you know what happens there. That is where actual surgery is done. Then we have a scrap room where the surgeon and the scrap nurse use. That is the area from where they change. They unwash. Sterile store or procedure setting room. We have the recovery room or the PACU area. We talked about the sleuth room where all the contaminated instruments are taken for initial cleaning and decontamination. Now, you know the precautions to take while in theater. You know what you should not do. Do not manipulate sharps by use of hands. Of course, use an instrument to attach blade to its handle. Do not recap used needles. This does not only apply to theater, but all through. You are not required. You should not recap needles. I ever saw this happen, but sometimes when you are rotating there and you are rotating in hospital and you have not had a prior experience of how you should handle needles, you can find yourself make such a mistake. But once you are told not to, you learn. So next you want to recap. It is easy to suffer or get needle stick injuries, and of course you know what happens later if your patient had some disease which can be transmitted that way. So something to do with gloves. When the glove is torn, you make sure you remove the any sharp. You squeeze blood from that area and wash under running water, and then you report the incidents. So you ensure that all instruments are decontaminated thoroughly, and if there is any soiled linen, you should handle in a proper manner. And also should be taken to the laundry. Those are some of the things that we should do as nurses. These are actually our roles. The hand washing should be done with an antimicrobial agent. And every other time you have contact, ensure with contaminated items, all those that are suspected to be contaminated, you should do what? You should perform an hand wash. Someone said when you are not sure whether an instrument is sterile, then you suspect it's not sterile. That is that you assume it's not sterile. Yeah. Anytime you suspect like that. Now, legal aspects of theater. So we say that each team member in the operating theater is responsible for their own actions. That is what is there. If you mess as an individual, and of course you can suffer legal consequences that way. Yeah, if it's a surgeon mwenye alifanya makosa, is the one to be followed in case the surgery becomes botched, or if there's a botched surgery, or if there is something that happens on the way and the outcome is not successful, not good, they will face liability for the actions as individuals. So sometimes when there is a case in court, they follow up to know whether it's the nurse who messed up or the surgeon. So if you forget, you don't count the equipment as used for surgery, then of course a nurse will be held responsible. You are the one to account And so the mistake, you take the liability, of course. Documentation of patient care, that is our work. We don't do things, we don't depend on verbal communication. Ensure you document. Verbal communication does not form defense in a court of law. So ensure that everything is written, and any patient records should be properly preserved as evidence of care received or care omitted. Now, I think up to that point we can look at benefits of documentation. Of course, you know, it's a legal permanent record. It is important for billing and the reimbursement. We can tell how many IV lines were used, how many ringers, how many of ringers lactate or normal saline we infused, and like that, and we're able to do billing properly. For continuous quality improvement, documentation also helps for continuous continuous quality improvement. It is useful for budgeting and financial planning, for research, management of risks, and it's also helpful in assessing the quality of care. Ethical issues. The nurse working together should have the following qualities: should be alert, truthful, honest, should have integrity. You know, these days, even before you get a job, oh, that was lifted, but there was a requirement for you to show that you are compliant with article, I don't know which article was that, of the Constitution that emphasizes on integrity. So equally, a nurse must observe integrity. By integrity, we mean the nurse should be able to adhere to own values and those of the profession. You know, the interventions that are beneficial and those that cause harm, and which to give and when. Yeah, that's what we mean by integrity. There are certain actions that amount to breach of integrity, or that show that an individual lacks integrity. For example, when you sell medication to patients, do you have integrity? In such a case, can we say such a person has integrity? Or you are conning the money in some kind of fraudulent activities, or it's not good for nurses to do so. Duties of the nurse in theater. What does the receiving nurse do? The receiving nurse, even as the word suggests, will be cleaning the patient's trolleys, confirms availability and sustainability of medical gases, collect the theater list from the wards, ensures that the patient is relaxed, reduces anxiety, and reassures the patient, identifies the patient by name, age, and their role in the community or their family, checks the preparations done by the ward nurse, confirms the diagnosis. Very important, confirm the diagnosis. There was a case in previous years where a patient underwent surgery that he was not due for. I mean, an operation that actually was totally unneeded. So you can imagine, if you didn't check, you can take a patient, you do a lumbar puncture only to realize they were not scheduled for the same. So anesthetic nurse is another cadre of is another one. This is an unsterile member of theater team who receives the patient from the receiving area. Then they have additional roles: prepares the anesthetic drugs and equipment necessary for the operation, makes sure that the suction machine is operational, makes sure that the drugs needed for emergency are at hand, reassesses the patient's physical condition immediately prior to initiating anesthesia. That's what they do. Members of the anesthetic team, what they do with the drugs and all those and the equipment that we use, zile zinakwanga hapo, that falls squarely within the docket. Circulating nurse is one or two nurses are allocated. Yeah, one or two nurses may be allocated depending on the operations. So the circulating nurse ensures that the nursing process is carried out throughout the operation, ensures that the sterile environment is maintained to implement the principles of asepsis. So today you have seen that is the duty of the circulating nurse to ensure that asepsis is observed. Stands away from the sterile field so as to observe and direct the sterile team to absolute sterility. The circulating nurse will be observing sterility, will be checking to see whether anyone is about to breach sterility. Provide assistance to any member of the sterile team in order and in the manner of qualification to supply equipment to enhance its effectiveness. Even equipment, they can be involved in supply of equipment. Wanaweza ambiwa blade imekosa ama something else wanaleta. Now, tuende kwa mtu anaitwa scrub nurse, member of the sterile team who scrubs and lays trays for a surgical procedure, also called sterile or instrument nurse. The duties include responsible for maintaining integrity, safety, and efficiency of the sterile field throughout the procedure, responds to the needs of the surgeon, the keen observer of the patient, that's another role, ensures the correctness of the equipment, sponges, sutures, green towels, and gauzes before the cavities are closed. Huyu ndiye anatafuta. Huyu ni anasaidianga surgeon. I hope all of us did this. Yeah, I worked as a scrub nurse. So at the end of the procedure, at the end of the surgery, I had to check, ensure that the numbers I had at the beginning are the numbers we ended up with. So by doing a count, some actual counts, physical counts of all this, the sutures, punches, green towels, I did that. And then of course, I had an additional role. I took this for sterilization of the equipment. Responsible for any specimen taken during the procedure. The scrub nurse is responsible for any specimen taken during the procedure. If they are taking, if they are drawing blood, or I don't think whether it could be necessary to, you should draw blood earlier, for lab work. Of course, you need to know. This should be done prior to the procedure, prior to the surgery. I don't think you will demand a HB test or later when you are working. You do this early in time. And of course, important is that you also need to check the platelets. I realized before you engage in surgery, the surgeon could want to know the level of platelets. Of course, if you don't check, what if the patient bleeds? Do you realize there was an issue you do with thrombocytopenia? Will you be able to save the patient? So you look at those values. They are not done cosmetically, but to help the surgical team make a decision. So even before you bring a patient, make sure these investigations are carried out. Draw blood for cross-matching, grouping and cross-matching also. Check the HB levels and also other values that of essence to the surgical team. Now, we have recovery nurse. This is a post-anesthetic nurse who waits in the recovery room in order to assess for any deviation from normal. This nurse will be looking at vitals. When there are those, how do you call those monitors? If they are cardiac monitors or anything else, they will be looking at, those machines, checking the blood pressure, the vital signs, and try to see whether the patient is improving or not. So receive the patient from the anesthetic nurse, receives the patient's file, assesses the level of consciousness, pulse rate, cyanosis or pallor, sets the sites from where bleeding could be possible, takes report of blood loss and blood transfusion, notes any vomiting and records the amount, ensures the patient is comfortable, observes the drains, checks the underwater seal, NGT, that is nasogastric tubes, IV lines, catheters, and the wound dressing. This guy is responsible for all that. And to ensure that the patient is comfortable, observes the drains, the underwater seals, nasogastric tubes, IV lines, catheters, and wound dressing. Assist in post-operation resuscitation, drawing the drugs, and positioning. Hands over the patient to the ward nurse after full recovery. some patients are taken to ICU. In such a case, of course, this nurse will assist. 29, principles of sterile technique. We have sterilization, and here we say instruments and all the necessary materials should be ready before any invasive procedure is done. The principle of skin preparation is saying prepare the sterile field and care for the surgical site. Then C, we say maintenance of asepsis, creation and retention of the sterile field, including skin preparation and draping, wearing masks. Ensure you maintain asepsis, prepare sterile field. Also prepare the skin. How do they prepare the skin? We use such substances as, we call them substances. Povidone, yeah, the iodine. Make sure you prepare the skin. Terminal disinfection and sterilization after the procedure. You disinfect equipment, you sterilize services, you disinfect services, you sterilize the equipment and instruments and the services as well. 30 slide. Our next slide is on characteristics of the sterile field. Characteristics of the sterile field. One, we are saying only the sterile items are used in the field. Whenever equipment or a part is suspected to be contaminated, it should not be used. So any object, any instrument, any equipment that is suspected to be contaminated should not be used. Confirm the actual timing of the surgery. Ensure that the autoclave is functional. Yeah, if the autoclave is there. So you know what the autoclave machine does. Yeah, but I have never seen an autoclave near theater. We used to take the equipment, the instruments to another place. So wherever I was working, if it can be within the theater premises, I don't know. Some hospitals could, of course, have. Gowns are considered sterile only from the chest and the sterile field in front and 2 inches above the elbow. I think this could be better shown by a demonstration, and I'll find somewhere, I'll find a photo or so and send and show you the parts that I consider sterile. Just only from the chest field, only from where? From the chest and the sterile field in front and 2 inches above the elbow. Those are the parts that I consider sterile. Self-gowning is discouraged. Don't go wear a gown by yourself. The runner nurse can help. So unafaa kuvalishwa. Hands should be kept away from the face. Do not touch. After gloving, don't touch your face after you don gloves. The tables are sterile only on the top surface. Do not touch any other part below the top surface. Yeah, that is clear. Supplies should be readily available. The supplier should be sterile, especially the runner nurse. Now let's look at draping, which is the process of covering the patient and the surrounding areas with a sterile barrier to create and maintain the sterile field. So we must consider the following. Draping must be done correctly. The scrub nurse should know it properly and be ready for it. During draping, the circulating nurse may also assist scrub nurse so that it is done satisfactorily. Principles of draping include ensure that all the drapes for use are dry. You don't need dampness. If they are damp, of course, that might lead to bacterial growth. You know, bacteria like places which are damp. Allow sufficient time to allow proper application. Allow sufficient space for access to the surgical site. Next is ensure that the drapes are straight, tight, and in place, and broad enough to cover out the other parts. Don't bring in very short drapes, of course, leaving other parts of the body uncovered. The sterile field should be steady throughout the surgical procedure. Yeah. Falling of drapes or contact with suspect surfaces, once it falls, it should not be used. Classification of instruments. Surgical instruments are designed to provide the tools that the surgeon needs for every maneuver in every procedure. So we'll classify these instruments as one, cutting and dissecting instruments. Those ones have sharp edges. They are used to dissect, incise, or separate or excise a tissue. They should be kept separate from the other instruments, because the sharp edges can be made blunt, they can be destroyed. So all the sharp instruments, the cutting and dissecting instruments should be kept separate from the other instruments. Then we have something else. We have is that bone cutters and banking tools. We also have grasping and holding tools. We have bone cutters and debunking tools. They have cutting edges favorable for cutting through the bones, called bone cutters, used for reducing the bulk of the firm tissues. We have, for example, chisels, osteostomes, and files. So if it's an orthopedic surgeon who's trying to do some operation, of course, these are the kind of tools that they use. We have grasping and holding tools. They are used to hold tissues in position so that the surgeon can perform the desired maneuvers. We have toothed forceps, which provide a firm grip on the tough tissues. Toothed forceps. Exposing and retracting tools. These ones retract the skin to expose the soft tissues. They expose the tissues to be operated on. And we also have clamping and occluding tools. They are used to apply pressure. For example, the hemostatic forceps. We also have viewing instruments, which are used to visualize the interior hollow organs, cavities, and to perform some procedures. For example, a cystoscope, speculum, and an endoscope. Can use an endoscope to visualize the internal of the stomach. Yeah. Suctioning and aspirating tools. They are used to remove blood and body fluids, tissues, and irrigating solutions from the cavities. We have dilating and propping instruments, which are used to dilate or enlarge orifices and the ducts. So if it's the vaginal orifice, we can use this to dilate it. A prop is used to explore a structure and to locate the obstruction due to a foreign body or a blood clot or some cancerous tissue. So an instrument we call a prop, that is, it is work to explore a structure to locate the obstruction due to a foreign body or blood clot or because of a cancerous tissue. Measuring instruments include rulers, depth gauges, trioscias. All are used to estimate the size of a mass or the size of the implant needed. Measuring instruments can have rulers, of course, in theater. Laying a sterile trolley. This one, I think all of us are aware how we do it. And let me talk about what else. Positioning patients. When you are while positioning the patient for surgery, there's need to have adequate knowledge of anatomy and application of physiologic principles. So some of the factors you consider before you position patients is the height of the persons and the patient or surgeon. Yeah, you consider the height of the surgeon, the height of the patient, age, weight of the patient, cardiopulmonary status, and pre-existing diseases. Do you know why it's important to know the cardiopulmonary status? If they have a cardiac problem and you position them in some way, of course, that can even lead to cardiac arrest, some failure, of course. Kidney position, lateral position. Now, we have positions. We are talking about positions. Here, positions used in theater. We have the supine, which we call the dorsal, prone, Trendelen's back. You have kidney position, lateral position, lithotomy, jackknives. Patient is in prone position and the table is flexed at the hips. It is used for rectal operations. So let's talk about these positions because I normally see questions come. So prone, the patient lies on the abdomen and is put on anesthesia before positioning. Patient lies on the abdomen. Even you're prone. Trenderen's back. Back. The patient is in supine position and the table is broken at the knees and the head is tilted downwards at 45 degrees. Kichwa iko chini ya mwili mwingine. Then we have kidney position. Patient is positioned on the lateral side of the unaffected kidney. When they have a kidney problem, you position them on the lateral side of the unaffected kidney. The kidney bridge is used to elevate the kidney and increase the distance between the lower limbs and the iliac crests. Lateral position, the patient is laid on the side before being given anesthesia, having the patient lie on supine and slowly turn them onto the unaffected side. Lithotomy, strip-ups are put at right angles of the body and the knees are flexed and the buttocks are at the edge of the operating table. I assume we know these positions. I don't have the pictures, of course, to demonstrate, but we know them. Jackknives, of course, I read it. The patient is in prone position and the table is flexed at the hips. It is used for rectal operations. Sitting or high fallers position is used for neurosurgical operations. Now, what are some of the emergencies in the operating theater? We have cardiac arrest, and the causes, one is overuse of anesthetic agents, and a specific drug medication here called iopentone is responsible. Untreated hemorrhage, which as a result causes hypothalamic shock. Aspirated vomiters during surgery. Kinked endotracheal tube can cause cardiac arrest. Management, adrenaline. Okay, 100% oxygen therapy, which could correct tissue hypoxia. Adrenaline could improve cerebral and myocardial perfusion. You can give atropine, which increases the action of the sinoatrial node, improves ventricular circulation. You can also do sodium hydrocarbonate, which could correct metabolic acidosis. You give magnesium ions, which could promote functioning of the cellular, sodium and potassium ions. Vasopressin could increase the inotropic action of the heart. So you can give potassium ions also. Respiratory arrest, that is sudden life-threatening deterioration of the lung function. The oxygen exchange is impaired. That's what causes respiratory arrest. So it's caused by excessive use of anesthetic agents and opioids, obstruction of the airway leading to anoxia. Anoxia and respirations may stop. Signs and symptoms include progressive deterioration, that is overdose anesthetic, lack of flow, obstruction of the airway, cyanosis, the blue tinge of the skin, bluish tinge of the skin. You will easily tell that someone is cyanosed by looking at the skin. If it is bluish in color, of course, cyanosis are setting. Respirations become difficult. There could be gasping, for example. Total respiratory failure. Management can do intubation, or if you identify the problem immediately, you can restore adequate gaseous exchange. For example, if you realize that the oxygen mask or is not properly fitted, or there was a problem with the flow of oxygen, you correct that immediately. Then you can also do intubation, use of mechanical ventilation, until the underlying cause is treated. Another emergency is anesthetic reaction, which the management of it is you can first start with 100% oxygen therapy. You also administer adrenaline. You can do IV antihistamines, corticosteroids. You can administer IV fluids to expand the intravascular fluid volume. Yes. Next is fire and explosions in theater, and how we can go about that. So the precautions is that any thermal devices can cause fire or explosion. Precariously use laser beam. Make sure it is directed away from drapes, sponges, gowns, or plastics. Electrosurgical units shouldn't be used around the neck because this may cause explosion. The beam of the fiber optic light carrier shouldn't be directed towards a drape until it is sufficient to cause or produce burning. So those are some of the precautions you can take to prevent fire in theater. The fire safety, of course, we are saying all healthcare facilities should have a fire warning and safety system, and the theater staff should be familiar with fire extinguishers, where they are located, and how to do evacuation in case of an inferno. So fire extinguishers are classified into three classes. We have the red, which contains pepper, good, blue contains CO2, black contains halogenated gases. During a fire extinguishing exercise, do not panic, but should do the following. Race, which we remember well with the mnemonic race. R is rescue anyone in immediate danger, activate the fire alarm, contain the fire if possible, then evacuate people from the area. Yeah, the people and the machines if possible. So guys, that brings us to the end of the lesson. You can also remember to like and comment and subscribe till our next lesson when I'll bring you more. Stay tuned. Thank you for watching.